Blog Talk Radio.
Welcome to Partners in Health and Biz with your host, Gail Dixon. Tune in every Saturday, 9 a.m. for great shows about obtaining and maintaining health, business, and finance. Learn from the experts here at PIHradio.net. And now, broadcasting from the Partners in Health and Biz studio, here's Gail.
Well, good morning, everyone. Good morning. Welcome to my show. This is, as you heard, Partners in Health and Biz. You are listening live. We are broadcasting right now, if you're tuning in to our show, broadcasting live from our Columbia, Maryland studio. So happy you could join me. If you are a first-time listener, so happy. Welcome, welcome, welcome. And if you have been with us for the last 7 years, continue to listen because we have great things yet to come. So if you've been to the website, you know that today's show is a very important show because this week, from the beginning of the week and through today, is National Influenza Vaccination Week. Yes. And we want to encourage everyone to make sure that you get your vaccination because it's very important. So we have some information that you are going to want to hear. Some people believe in getting the flu shot. Others are totally against it and have their reasons. But we want this morning to give you the facts. In fact, we're going to give you information on in case you want to get the flu shot, and you want to learn all about what's going on with the flu shot, the influenza vaccination, or if you think, well, maybe I can avoid getting a flu shot. So if you can avoid getting a flu shot, what are some of the things you can do? What are some of the things that you can do to prevent yourself from having to get the flu shot? So let's jump right into it. First of all, I want to give out the call-in number to Partners in Health and Biz, which is 347-945-7433. 347-945-7433. Press 1 if you have a question or a comment, and you don't have to do anything if you just want to continue to listen to the show. So the CDC established National Influenza Vaccination Week back in 2005 to highlight the importance of continuing flu vaccination throughout the holiday season and beyond. Some people feel that, well, if I haven't received the flu shot already, it's probably too late. But this week was just a push to get that information out, and that flu vaccination coverage estimates from the past seasons have actually shown that few people get vaccinated against influenza after the end of November. But it's not too late. The CDC and its partners choose December for National Influenza Vaccination Week to remind people that even though the holiday season has begun, again, it's not too late to get a flu vaccine. As long as flu viruses are spreading and causing illnesses, vaccinations should continue throughout flu season in order to protect as many people as possible against the flu. So you say, well, why is this? It's because if you did not receive a flu vaccination and someone else did not, and you are contaminating, you could possibly be contaminating other people by you being out in the public coughing and sneezing or whatever. You should be, of course, in bed resting if you have the flu. But sometimes we don't even know at the beginning that we have the flu. We think it's a bad cold, and then it continues to get worse, and then we have a fever. So vaccination efforts should continue throughout the holiday season and beyond. It's not too late. Getting vaccinated later can still be beneficial and should be done as soon as possible before flu begins spreading in your community. And even if you haven't yet been vaccinated and have already gotten sick with the flu, you can still benefit from vaccination since the flu vaccine protects against 3 or even 4 different flu viruses, depending on which flu vaccine you get. So, yes, there are different strains of the flu. And some of us have said, well, I've gotten the flu shot, I received the flu shot in the past, but I still came down with the flu. Well, maybe you did get the flu, but maybe it wasn't a severe case of the flu because as you know, many people have died because of the flu, the side effects of the flu, the fever and the nausea and things, and especially as if you're a younger person, a little child, or an older adult, then the flu will affect you in a greater way than it would, say, for instance, someone who's only in their 20s, perhaps. And it's very important because flu isn't a bad cold, contrary to popular belief. Some people feel that way. Well, maybe the flu is just a bad cold. Well, the flu isn't a bad cold, and it can result in serious health problems, which the complications can be such as pneumonia, bacterial infections, or you can be hospitalized. My dad recently was hospitalized with pneumonia. He did get the flu, but he did get the flu shot, the influenza vaccination, but he was in the hospital for about 4 or 5 days, and he's out now, thank God. But it could have been a lot worse if he didn't. If he hadn't. And there's two vaccinations. You can get the flu vaccination, and then there's a shot for pneumonia as well. So there are two different shots. The CDC and pharmaceutical companies recommend that people over 65 or 65 and over also not only get the flu shot but get the shot for pneumonia. Now, most people who get the flu will recover in a few days to less than 2 weeks. But some people will develop serious flu complications. And during the 2017 through 2018 flu season, which we are in now, the CDC estimates flu caused, and listen to this, 49 million flu illnesses, more than the combined populations of Texas and Florida. 960,000 flu hospitalizations already, more than the number of staffed hospital beds in the United States. 79,000 deaths. I repeat, 79,000 deaths, more than the average number of people who attend the Super Bowl year. Wow. That's all people are at risk for serious flu-related complications, and certain groups are at a higher risk. So people at high risk of serious flu complications, as I mentioned earlier, include young children, pregnant women, people with certain chronic health conditions like asthma, diabetes, heart disease, or lung disease, and people that are 65 years and older. So for people at high risk, getting the flu can be more serious than for other people. And flu is more likely to lead to serious flu complications that can, as I was telling you, result in hospitalization or even death. And anyone who gets flu can pass it to someone at high risk of severe illness. So don't think that, I didn't get the flu shot, I don't want to get the flu shot, I'm okay. Well, think about the other people you can contaminate if you have the flu at the beginning of it and don't know. And they're young children, that your children or grandchildren, including younger children that are 6 months or less who are too young to get a flu vaccine. So you don't want to be responsible for contaminating a baby who contracted the flu because you contaminated them. So the many benefits of the flu vaccination. We're going to discuss those. People, there are benefits and there are some side effects. Let's be honest. So a flu vaccine has many benefits. Okay, first of all, flu vaccination can keep you from getting sick with the flu. Not all the time totally preventing the flu, but it can. In many cases, can keep you from getting the flu. And during the 2016-17 flu season, flu vaccine prevented an estimated 5.3 million flu illnesses. This was the last flu season that we had, not the current season that we're in, about the population of the Atlanta metropolitan area. 2.6 million flu medical visits, more than the number of students in all K through 12 schools in Florida. 85,000 flu hospitalizations, more than the number of hospital beds in California and Oregon. Flu vaccination helps prevent serious medical events associated with some chronic conditions. So what are some of those chronic conditions that so vaccination has been associated with lower rates of some cardiac events among people with heart disease, especially those who had a cardiac event in the past year. Flu vaccination has been shown in separate studies to be associated with reduced hospitalizations among people with diabetes and chronic lung disease. Now, I know both of my parents have diabetes, so they always get the flu vaccination, because if they don't, being that they do have diabetes, that could make their condition worse. It could cause complications. Vaccination helps protect women during and after pregnancy. A 2018 study showed that getting a flu shot reduced a pregnant woman's risk of being hospitalized with flu by an average of 40%. Flu vaccine can be life-saving in children. A 2017 study was the first of its kind to show that flu vaccination can significantly reduce a child's risk of dying from flu. And you hear so many sad stories every year of little children dying of the flu, which is a very sad thing. No parent wants to see their child sick and let alone die of the flu, especially if it can be avoided. Flu vaccination has been shown in several studies to reduce severity of illness in people who get vaccination but still get sick. Okay, what else? Getting vaccinating yourself, vaccinated, may also protect the people around you, as we discussed earlier, including those who are most vulnerable to serious flu illness, like babies and young children, older people, and people with certain chronic health diseases. Now, the National Influenza Virus Week key message, and what is that? What is the key message that they want you to know? Well, the CDC has developed a number of tools and materials for organizations across the country to aid their vaccination efforts during National Influenza Vaccination Week. And every year, people around the world work to study, track, and prevent flu. And so some of the people that have worked to help to fight, and they are called flu fighters, to contribute to flu prevention in the United States and around the world. One, Dr. John Barnes. Dr. John Barnes, and he is with the Centers for Disease Control. Dr. John Barnes is a microbiologist and team lead for the CDC's influenza genomics team. And in a world where influenza viruses are constantly changing and evolving, this team examines the genomes of thousands of influenza viruses a year. Flu is both a fascinating and frustrating virus to study, according to Dr. Barnes. Influenza viruses have a unique ability to move through the genetic space very quickly. Every week there is a new curveball that could literally leave us looking at changes in the viruses that we have never seen before. And as you know, each year there seems to be a different strain of the flu virus. It just changes. Also, Lisa Delaney, she's the director of the Emergency Response and Preparedness Office at the National Institute of Occupational Safety and Health. Lynette Brammer, team lead. There are so many people. Lynette Brammer, is the team lead of the CDC's Domestic Influenza Surveillance Team. So we have these people. They want you during this week and beyond to spread the word, to let other folks know that this is the time you still need to get your vaccination against to protect yourself against the flu.